Conjunctivitis, also known as pink eye, is a common and often contagious inflammation or infection of the conjunctiva, the transparent membrane that covers the white part of your eyeball and lines the inside of your eyelids. Individuals with conjunctivitis typically experience redness in one or both eyes, accompanied by a gritty feeling as if there is sand in the eye, and may also notice a discharge that can cause the eyelids to stick together, especially after sleeping. Other symptoms can include itchiness, tearing, and a burning sensation, which can cause considerable discomfort but generally do not affect vision. Treatment for conjunctivitis depends on the cause and can include antibiotic drops for bacterial cases, antihistamines for allergic reactions, or simple home remedies such as a warm compress to ease discomfort in viral instances. Common risk factors for developing pink eye include exposure to someone infected with the viral or bacterial form, allergic reactions to substances like pollen or pet dander, or irritants such as smoke and chlorine. Now let's delve deeper into the various facets of this widespread affliction. Here are detailed aspects of the disease. Symptoms and progression of conjunctivitis. Conjunctivitis, often referred to as pink eye, presents with hallmark symptoms including the reddening of the white part of the eye, which is a direct consequence of inflammation and dilation of tiny blood vessels within the conjunctiva. This eye condition may progress with varying symptoms, such as itchiness, a gritty feeling as if something were in the eye, and a discharge that can form a crust during sleep, leading to the eyes being stuck shut upon waking. In viral forms, watery discharge is common, while bacterial conjunctivitis often results in a thicker yellow-green discharge. Allergic conjunctivitis tends to cause significant itching and watery eyes, often accompanied by seasonal allergy symptoms like a runny nose. Vision may be temporarily blurred due to the discharge, but it usually does not affect eyesight. The progression of symptoms is typically rapid, and they can spread from one eye to the other, especially if caused by an infection. Understanding these symptoms is crucial for timely treatment and limiting the spread of the condition, particularly the infectious forms. Diagnosis of conjunctivitis. The diagnosis of conjunctivitis, commonly referred to as pink eye, hinges on a combination of clinical presentation and meticulous patient history. Key symptoms include redness, itching, tearing, and discharge, which might be watery or purulent depending on the type: viral, bacterial, allergic, or irritative. A clinician may note eyelid swelling and reactive lymph nodes near the ear or jaw. For an accurate diagnosis, a slit lamp examination can discern fine details such as subtle corneal involvement. In ambiguous cases or severe infections, laboratory tests, such as conjunctival swabs for culture or PCR, can identify the causative agent, aiding in targeted treatment and limiting the spread of infectious conjunctivitis. Timely and correct diagnosis is crucial, as mismanagement can lead to prolonged discomfort or complications, including keratitis or vision impairment. Cause and risk factor of conjunctivitis. Conjunctivitis, commonly known as pink eye, can stem from various origins, including viral, bacterial, or allergic sources. Viral conjunctivitis is highly contagious, often caused by adenoviruses, the perpetrators of respiratory illnesses. Bacterial conjunctivitis, while also infectious, can be the result of bacteria like Staphylococcus aureus or Streptococcus pneumoniae. On the other hand, allergic conjunctivitis is not contagious, triggered by allergens like pollen or pet dander. Risk factors increase for those regularly in close contact with others, particularly in crowded or sanitation-compromised environments, and among those who have allergic predispositions or are frequently exposed to irritants. Treatment and management of conjunctivitis. Treatment and management of conjunctivitis, commonly known as pink eye, hinge on the underlying cause. Bacterial conjunctivitis requires antibiotic eye drops or ointments to eliminate the infection. Conversely, viral conjunctivitis, often stemming from the same viruses that cause the common cold, has no specific treatment, and care focuses on relief of symptoms. It generally resolves on its own within a few weeks. Allergic conjunctivitis is tackled by avoiding allergens and may be treated with antihistamine or steroid eye drops to quell inflammation. Keeping the eye area clean, avoiding contact lens wear during infection, and not touching or rubbing the eyes are imperative to prevent spread or worsening of the condition.